Good evening and a very warm welcome to all of you who have been present here today for yet another masterclass in Advances in Embryology series. Today, the topic is very important. The backbone of an IVF lab, the must-have equipment for fertility. With the booming fertility centers coming up every day, so many, across Chennai, everybody is, kind of inaugurating new centers very frequently. But very importantly, we should also invest on appropriate equipments to give appropriate success rates to our patients. And also, I believe the man behind the machine is very important. Even though you invest in a lot of equipment, I think the expertise to use those equipment is equally important. And to reinforce this fact, we have with us Dr. Priya Kannan, who is well known among the field of reproductive medicine, very popular among embryologists, very vibrant speaker, teacher, and I'm sure she will get across to all of you through this talk. I would like to take a few moments to introduce her. She's a very good friend of mine, but to her academic credentials, she has a whole lot of things to tell you. A few of them are she's a present position. She holds the secretary of Tamil Nadu chapter of IFS. She's a secretary of IMH Kodambakam branch. She is also Chennai district coordinator for Rakshambigai Fertility Center, Chennai and Trichy. She's got various scientific contributions. She's authored many chapters in various textbooks, and she is an invited resource person in many national and international conferences. And it doesn't end there, because she's been a co-investigator in many research projects, UGC major project, and also a co-investigator in association of exogenous DNA with mammalian spermatozoa at Monash University. Few prestigious past positions held by her are: she was a past president of ACE, organizing chairperson of 8th International Conference of Academy of Clinical Embryologists of India 2019, and she's the executive member of Central ISA from 20 to 22. We extend a wholehearted welcome to you, Dr. Priya. We request you to start the session, please.
Thank you. Thank you for the invite, and thank you for having me here. I'll start sharing now. Yes. Okay, so the topic given to me is must-have equipments of fertility labs. So I think that's a very interesting topic, and that's a very important topic as well, because we are looking at technology here. We are not looking at something, some theory thing here. We are looking at technology. Technology means equipments are the crux of what we do. There is nothing in the lab that moves or that happens without the use of technology and associated equipments. So the equipments make it the embryology lab, which is being operated by the embryologist. So let's start with the basics. Of course, we have 4 segments in all fertility labs right now. The ART law has made us into ART level 1 clinic and level 2 clinic. I've listed out first. I think that when the ART law came around, they gave one set of equipments that we must have. And then we were bewildered by that. So, and then we went back to them and said, this is not possible in a country like India, where if you are going to have such like equipment intensive, the luxuries to be as mandatory, then it's not going to happen in most labs, which means we cannot, with the number of population that we have, with the number of necessity of the services that we offer is going up because of the increase in infertility rates, then we may not have adequate labs to go. So then they thought about it and then came back with the mandatory things we must have. For an IVF, for an andrology lab, you must have a microscope, a centrifuge, and a refrigerator. This refrigerator is, of course, to store your media and all that stuff. For level 2 clinics, they have mentioned microscope, incubator, minimum 2 number. They have also mentioned that. Laminar airflow, sperm counting chamber, centrifuge, refrigerator, equipment for cryopreservation, Ohm aspiration pump, ultrasound with transvaginal probe and a needle guard, test tube warmer and anesthesia trolley. And of course, for the ART banks, they want you to have the centrifuge machine, incubator, microscope, laminar airflow. This is primarily for storage of sperms. ART banks, unless otherwise they are associated with the ART clinic, they have level 2 ART clinic, they cannot do any oocyte harvesting at that in that premises. Surrogacy clinic also, it mimics or it mirrors the level 2 clinics, and only if you have a level 2 clinic, you can apply for surrogacy clinic. So let's take it one by one. In a level 1 clinic, which is the same as the andrology lab, you will use for an embryology lab as well. So it is imperative that you have these equipments, because without this, you cannot assess the sperms or make a diagnosis of it. You need to have a microscope. The microscope here, what you need is a biological microscope, not the stereo zoom or the inverted. But when you want to have a good lab, you want to have a good vision of the sperms, we do not recommend that you have the regular biological microscope. If you have the biological microscope, the picture that you will have is of the sperms is what I have mentioned here is the bright field picture of the sperms, which is like a vague sperm. You will see something like that. Whereas if you have a phase contrast, you will be able to beautifully see the sperms, look at the morphology, and also be able to differentiate and do morphological analysis of the sperms that are given to you. So if you have a microscope, you want to have one and you want to have a good one, phase contrast is the way to go. Counting chambers, sperm motility assessment or count and motility assessment. Yes, the improved Newbar chamber is what the WHO mandates or is the gold standard. But for ease of training, for the ease of doing analysis, I think a lot of us, most of us have shifted for decades to the Maker's counting chamber, which is easy because you can use the raw sperm, the raw semen on it. You don't have to dilute it max. If you don't have like if you have more than 300 million, then you might have to dilute it and back calculate. But otherwise, you can use the raw semen. And then you have to count 10 squares, the count and the percentage of motility in it. And it makes it simpler for me to do it and for me to train the umpteen number of junior embryologists that I keep training on a regular basis. Then you need the heating block. This is not given in the mandatory list by the ART law, but without this, you will not be able to process your semen sample or calibrate your sperm washing media without bringing it to 37 degrees. So you absolutely need the heating blocks or the test tube warmers. If other than that, you can also have the dry bath, or sometime long ago, we used to use the wet bath as well. But now I think the heating blocks or the test tube warmer or the dry bath is more than enough. There are some, you can have incubators as well, heat incubators, or if you are using pH unstable media, you can use CO2 analyzers, CO2 incubators as well. But they are luxury. They don't need to have. This is the definite necessary that you need to have. Then the laminar airflow. You can have a laminar airflow as both mentioned, this is shown here. On the left one, which is got the blue one, you've got the filter. This is this. You've got that screen here, which is actually the ideal for a sperm and semen analysis, because semen is an infected sample. When the air is blowing away from the laminar airflow into the face of the observer, the infected material from the semen can be pushed onto the face of the observer, and hence this is the ideal for a semen analysis. However, which is not the case, the one shown on the right with the microscope and the test tube warmer and the imaging system is the most commonly used, but a small laminar airflow is good to have, is not mandated to have. A centrifuge is necessary, otherwise we will not be able to process a sample. A basic Remy centrifuge is what is important. That is necessary as well. But if you want to do a luxury item, then you can go ahead and use the spermfuge, which means the centrifuge itself is temperature control and everything happens at 37 degrees. In a level 2 clinic, you absolutely need what has been shown already in a level 2 as well, because you need to have an andrology setup in the level 2 as well. But apart from that, you're going to handle oocyte and embryos. So you need to have some other advanced equipments. Number one is a stereo zoom microscope. Why a stereo zoom microscope instead of a biological microscope or a phase contrast? It is because primarily of the working distance that you have between the stage and the objectives. You need to have that, because otherwise we will not be able to pick up the sperms or denude, pick up the eggs or denude or manipulate the embryos here. So, or vitrify or thaw, everything happens in this. Identification of the cumulus oocyte complexes, denudation, transfer from one dish to another, IVF, when you're doing conventional IVF, if you're doing vitrification, warming, embryo transfers, loading of the catheters during embryo transfers, everything happens in the under the stereo zoom microscope. It is preferred. I think at this point of stage, you must have a trinocular stereo zoom microscope, because every stereo zoom microscope is connected to a imaging. So it is better to have a trinocular, and it must have a heated stage. It could be either integrated or standalone, but a heated stage is mandatory. You must be, when you check out something, it is best to check out something you can be able to change the bulb. We must learn this, because after every 1 and 2 or 3 years, we might need to change the bulb because it fuse goes off. And if it happens right in the middle of our procedures, we should be able to, as embryologists, we have to change the bulb. So it is something easy access to the bulb. It should be easy to maintain. Look at the service availability of this, because this is one of the most important equipment that you need. And a backup. There are certain equipments in which a backup is good to have. That means a second setup is good to have. This is probably one of it, because our absolute workflow in the embryology lab is dependent on the presence and work of the stereo zoom microscope. So this is what I meant as either the stereo zoom can be integrated or not integrated. On the left side, you see the stereo zoom with a heated stages fitted on. The black one that you see on the top of the stage, that is a stereo zoom. That is the heated stage fitted on, and the microscope is placed on a hole inside the laminar airflow. Whereas on the right, you can see that the microscope is integrated with the laminar airflow, which means the heated stage, the steel surface here is heated and it continues along with it, so that you don't have a difference. You don't have to pick up the dish and keep it on the stage to do any manipulation. And right now, the non-integrated was the older setup. Usually nowadays, everything comes with the integrated stage. And then you need another set of microscopes that you need in the embryology lab is the inverted microscope. And this is used for manipulation of the eggs, which is during ICSI, or manipulation of the embryos, which is during embryo biopsy. We use, or as such, after that, we use this. This is probably the best place where you can grade the embryos and assess the embryos, because of the huge magnification that this microscopes allows us to have. This cannot be used in place of a stereo zoom, because the very minimal space we have between the stage on the condenser above, and here the objectives are placed below the stage. So that is not the thing. So we don't have much of a movement. So we cannot do other than the micro manipulation here. And of course, we need the heart to pump in for the blood to the body the same way. The heart of the embryology lab or the incubators, this is the crux of the incubator, because this is the embryo culture system. A minimum of 2 incubators is mandated by the law. Even if you're doing one case in the entire year, you need to have 2 incubators. And the more the cases you do, more the incubators you add on. For every incubator, it is recommended that you have a separate power backup in form of a UPS, so that at least one conks off, the other system, suppose your UPS goes off, you don't have power supply, the UPS goes off. If your two incubators are separate identities, then you can shift all the embryos and the gametes from one incubator and push it into the working incubator. If all your incubators are connected to one single UPS, then if the UPS comes off, all your incubators are gone. And it is also recommended to have separate cylinders for each incubator. And for each incubator, it is also, please ensure that you have an inline filter for the gases. So these are the types of incubators that we have. On the left is the thermoscientific, which is the box type of incubator, which is sort of is definitely required in a lab, because that is where we used to keep the test tube. That is where you can keep the test tubes for calibration of the media. On the right, of course, you can keep the dishes. Everything can be kept there. But when you're going for day 5 cultures, it is recommended that you use a benchtop incubator, such as the one on the right. I put the Cook Mink specifically because that was the first of its kind that came around, after which we have multitudes of desktop benchtop incubators that we have. And in that also you have two types. One is the dry and one is the humid. You can use any of it that you want. But that is something which was an evolution of the incubators, because the volume of the chambers are so small that it, when you open and close, it comes back to, it recovers very quickly. Then the laminar airflow, which it is mandated by our law to have, but there are countries, there are labs in our country also which does not use a laminar airflow, but by the law, we are mandated to have a laminar airflow. You can choose to have a 4 feet or 6 feet. The 2 feet laminar airflows are only for andrology. You need to have a 4 feet or a 6 feet for the embryology, depending on the space that you have and the workflow that you need. You can also have more than one laminar airflow, depending on your workflow. You can have it with or without imaging. That is, with or without the screen for everyone to see, with or without integration, as I showed you. So, but what is the purpose of laminar airflow? It is to have a sterile, stable, low noise and vibration-free environment for the manipulation of the gametes and the embryos. So that is one type of laminar airflow, which does not obviously have the integrated stage, because the as you see, the microscope is set as such right inside the laminar airflow. And here is the integrated laminar airflow, where you can see two microscopes that's been fit in here. It also has got a small incubator and imaging system and a test tube warmer there. Here is another type of integrated laminar airflow, where you can see one microscope, one stereozoom microscope with imaging system. So whether you want integrated or non-integrated is your choice. Whether you want with imaging or without imaging is also your choice. Whether you want one microscope stereozoom or two stereozoom is also your choice. But if you're looking at a busy lab, or if you say, I'm buying now, but then I'm going to probably expand a little bit later, but I'm happy with one stereozoom right now, I would recommend that you can buy a 6 feet, if you have the space, buy a 6 feet laminar airflow, put in a nice trinocular stereozoom to start with, but then have the integration. That is, without this microscope, only one rod will be sticking out. Buy it along with that, so that if at all you need another stereozoom to add, just buy the stereozoom and fit it on it. It starts working. You don't have to alter your integrated stage again, or buy a new one. And then the ovum aspiration pump, that's very important. And there is the analog one as seen on the left, which is a Kraft suction pump. And you can have the digital also, the one on the right. Does the same function, No difference except for this is the digital one is more aesthetic and a little bit more expensive. Performance is just the same. This is another of the equipment that I would definitely recommend that you have a backup one. If you don't have a backup, your clinician should be skilled enough to use a syringe to aspirate the needles when this comes off. So it is also something that I would definitely recommend that you have a backup or have a friend nearby who will be willing to loan you the ovum aspiration pump when there is a trouble with yours. As I said, recommended is 2. It is not mandated, but I feel it's something that you should have one as a backup. Otherwise, have a friend nearby. Keep your nearby fertility center as your friend. The other most important, this is not mandated, but I think for every lab right now, ICSI is part and parcel of a clinical embryology. It is not a luxury anymore. So you must have a micromanipulator. Micromanipulators are these attachments that we give to an inverted microscope using which we can micromanipulate the gametes and the embryos. Gametes to do ICSI or take a polar body biopsy. Embryos, when you want to do an embryo biopsy, laser assisted hatching, any of this, then you have to do this. You can have the Narishige, which is the hydraulic micromanipulator. You can have Ependo, which is the completely motorized micromanipulator, or the mechanical RI. It all depends on what is your budget and what you're already trained on. Some are, Narishige is probably the most common, but all of this functions the same. They are perfectly fine. Everything, the results are the same. It just depends on what is your preference of this very expensive machine. Of course, you need again digital, the tested warmers. Absolutely in IVF lab. If you need one in andrology, I would say you need at least 2 in embryology for you to A, warm the test tubes, B, to heat to your pH stable media and all that stuff. Then is a cryo machine. Cryo machine is mandated by the law. I wonder why. Because what I'm showing you are the machines that we used to use before when we were doing slow freezing. The one on the left is called the planar machine, which takes approximately about 3.5 hours to freeze the embryos, but you can do 10 samples, 10 at the same time. On the right side is the cryologic machine. But to be frank, the cryo machine that we use right now is one thermocol box. That's all we need when we are going to vitrify your embryos or oocytes or sperms. This is all we need. But this being the crux of the cryo machine that we are using now, you need some accessories to go along with it. Without that, your cryo is not complete at all. One or the cryo tanks. You need a cryo tank. When you're having cryo tanks, you need 3 types. One is you have to separate your sperms, your semen samples, and your embryos. You cannot have both in the same cryo tank. So you will have to have 2. And then so immediately you have minimum is 2 cryo tanks for you. You need to have one more cryo tank, which is exclusively only for storage of liquid nitrogen for you to keep refilling the cryo tanks again and again. So that is important. But for that, you need to have some, even if I say you're not having a motorized liquid nitrogen dispenser to do your refilling, you can use it during your thermocol box and a funnel, but you need some safety equipments. You need to have thermogloves. You need to have a scale which can go inside on a daily basis and check at least once in 3 days to check the level of the liquid nitrogen in that particular tank. If you need to have some tags to put around the cryologs that you're going to use. So these are the things that you definitely need, and goggles, those are the things you need to have in your cryo lab. In your cryo lab, your footwear is also quite important because you do not want any footwear that is close to the toes but open at the ankle, just in case your liquid nitrogen goes into your shoes. Then it goes through the ankle and stays at the tip without flowing out, which means you can have cryo injuries to your toes. So when you're in a cryo lab, have open toes or you cover the toe until your knees. That is the type of shoes that you must be using. Then, is this all that you need to have? Any machine needs to be checked on a daily basis or on a regular basis. So, even if it is not mandated in the ART law, quality control equipments are mandatory for every embryology lab, for which you need a thermometer, to measure the temperature in the incubators, B, to measure what is the temperature on all your working surfaces also. You need to have a CO2 analyzer. If you are using a benchtop incubator with trigas, you need to have a CO2 plus O2 analyzer as well. Both come in the same one. You also need a VOC meter. So all these things need to be on the run every day. So that is the set of thermometers that you can use. A CO2 analyzer, which is, I think, is mandatory for every embryology lab to have, and a VOC meter. The VOC meter should be on 24/7 in your embryology lab. Small but significant. You cannot run an embryology lab without these small instruments that we need as well. The pipettes, without which you can't aliquot things, media or oil or anything. A pipetter, for you to aliquot larger amounts of media into your test tubes. A mechanical denudation pipette or a mechanical handling pipette, that is something that's very important, because I think nowadays people don't know. I mean, we were the generation where we used to pull pipettes to denude. I don't think it happens right now. You need to have this. I would recommend this also into two, because one, if it doesn't work, nowadays the embryologists are not trained in pulling pipettes. So have this too, which is very inexpensive. So two of this is also something that I would recommend that you have. I cannot stress more or less on the importance of power backup, especially in our country and in also in our city. As I also mentioned, I have a power backup. My UPS is connected. The equipments that are connected to my UPS are my stereo zoom and my XC and my microscopes and my incubators. And I have two incubators. So I have two separate power backup for each. So one incubator, it does not require more than 2 kVA. And 2 kVA is too much for an incubator. So what I do is I split. I connect the stereo zoom into one. For two, in the other in UPS, I connect the XC machine also into it. So that if there is extra, I need extra, I put it into the theater UPS as well. So it is ideal that you put through all your equipments through a UPS, definitely your incubators. And I personally always recommend that you must have both your incubators must be independent of each other in terms of CO2, your gas supply, and your power backup, so that if one conks off, the other is at least working. Air handling unit is another important aspect. I have not put it here as a mandatory because the law, we did say that as mandatory before, it has taken it off. But I think it is still is optional if you want to have, if you're living in a place where it is not very clean, AHU is mandatory. But there are still lots of labs without having AHUs, but you can have a CODA filter as well. But IHU will improve your air quality, which in turn will improve your pregnancy rates. So thank you very much. I didn't want to bore you with on and on for 1 hour. So I stop here, but I'd be very, very happy to answer any of your queries on this subject or any subject in embryology. Thank you so much.
Thank you so much, Dr. Priya, for this elaborate talk on IVF lab equipments, actually. And you clearly, brought in the differences between level 1, level 2, what is mandatory in the law, what is not mandatory in the law. And, that's really very crisp and clear, this thing. However, we have few questions. And there is I would like to share a feedback from Ramaraju sir, who has said that it's an excellent talk which you delivered. It's also there. So sir has shared that with you.
Oh, wow.
Great
I
honor,
mean, sir
coming.
knows how much he means to me. It's, I think really look up to him as one of my mentors. So
Exactly.
thank you so much. Coming from him, it means extremely huge for me. Thank
Yes.
you, sir. Thank you so much.
So that's really, so great and huge respects to you, sir. Um, uh, there's a question that how do you decide between the models or brands of incubator, laminar airflow, and the micro manipulators? So many are available. Some are made in India. People are promoting that. And if so, is it based on the features, support, service, after sales service, or based on clinical outcomes?
Okay. Um, I think it has to have a mix of everything. There are standard incubators. Incubators are pretty much standard nowadays, which usually gives result. But you also have to look at your budget. That is number one. Number two is definitely the availability of service in your area. And something I also recommend is that do not put the service of all your equipments in the hands of one person. I prefer to have the it separately, like the microscopes to one person, the manipulator, of course, to the person whoever is the brand that I'm taking from, or the laminar airflow into one, and definitely incubators to somebody I trust and say, okay, they will take a good care, and when I have a problem, they'll be able to answer to me and attend to me immediately. See, for example, somebody from Chennai, for example, we are in Chennai or in Hyderabad or in these bigger cities, availability of service engineers is not very uncommon. They are quite here. But when you're looking at something away from the cities, the availability of service engineers goes down. The farther away from the city, the more difficult it becomes. So service becomes an issue. Pick something which is sturdier, which will not give you much problems. I would suggest that yes, the models is important, but for everything, service is also important. Sturdiness, something you want to set and you don't want to have a problem for the next 5-10 years. That's the kind of equipment you want. And another thing, in terms of at least micro manipulator and incubator, is something you should talk to your embryologist. Some are comfortable with some brands, and because they know how to handle those brands, quality control these brands, and adjust the settings if there is a problem. So in that case, the preference of your embryologist, the model that they prefer, would be of advantageous to you, because they can sort of sometimes quality control it themselves without the help of the service engineer.
So that's a good point there. So many of us, start centers and, there are a lot of, commercialization here and we're not able to decide. There's one package and then, one person does end to end. So you mean to say it is good to analyze each product and, have different vendors for different, this
Yes.
thing, rather than just give to one specific company and they are going to procure it to somebody and then, do it. So I think all of us, whether clinicians or embryologists, should have an in-depth knowledge about what it is basically before even giving orders to a specific person. Is that what you
You
mean?
can buy from anyone, but then after that 1 or 2 years, the warranty is not there. After that, it's free market where you can choose to give it to anybody you want. But then, see, monetarily, if you see, giving an N block to one company and giving it to 3-4 people who are in your city and who will help you works out almost the same. So instead of one person looking at all my equipments, it's good to have 4 persons looking at my equipments, no, separately. So I think it works better for me. And I think it's worked better for a lot of the labs that I manage. So I always keep that as my principle.
So, which is the equipment you think that is more prone to, create some issues in the lab? And, how do we, handle it when such a situation comes?
Sorry,
Which is
sorry.
which is the equipment in the lab which is more prone to problems, according to you? And, you go to so many centers you've handled. So, how do you handle when there's a critical event?
So for example, on Sunday, just this few days ago, I had to freeze embryos. And this is that integrated, beautiful looking laminar airflow, and the bulb chose to go off, conk off on that day, and I don't know how to change that bulb. Okay. So, but what I did, there was, as I told you, I had the other integrated stereo zoom working. So all I did was I took this microscope from this hanger and put it in the other hanger, and I started working. So we should be able to be, see, embryologists cannot be just looking at embryos. I feel we also have to learn some amount of physics and some amount of mechanics as well, so that we'll be able to repair a certain bit and then work on. There are umpteen number of times I have, the most common thing that you will have is the bulb fuse. So either in the micro manipulator, in the inverted microscope, or in the stereo zoom, both you should be able to change yourself. That's the most common thing. Otherwise, most equipments do not give a problem in embryology now. They are very sturdy.
You should keep a backup bulb with you. I had an
Yes,
experience.
always, always. For
Yeah.
stereo zoom also you have one. For the inverted microscope also you must have one.
It so happened that the bulb conked off, and then we had to hold a torch, and the embryology had to do the ICSI at that point. It was a nightmarish kind of a situation where there is no
Yes.
backup bulb. So I think that is
Yes,
one
you
of the-
must have one. It is always recommended to have one, and keep all those screwdrivers and everything that comes along with the star keys, everything with the comes with the equipment in one place, so you'll be able to find it. And it is also good to have the books of those equipments in a place where you can reachable, so that if you, for example, in my Ependoff, if it shows an error something, I have it near me so that I take it and say, if this error something that I need to immediately call the Ependoff people here, or it's something I can manage. So I have to do some setting change and it brings better. So that's something we need to always and read those books that's given to you, the manual of each equipment. Please go through it. It gives a lot of information about the equipment.
Okay. Do you also, there are a few questions here. How can we minimize environmental effects in the IVF lab?
Great question. You can have the AHU, but when you are having an AHU, you are having a controlled environment, which means you have to know from where your input of the air is coming from. And the AHU, when you have for an IVF lab, it cannot be combined with any other part of the hospital or the center. It has to be separate only for the theater and the lab alone. It cannot be combined with anything else. And if you want to minimize the environmental effects, this is it. This is how you do it.
So, do we have any specific regulatory body which provides correct SOP before establishing an IVF unit? I think every lab should have their own SOPs based on what equipments and what, and it should be revised on a periodic basis. But then again, I would allow you to say what you have to say.
True. I mean, you have your own SOP each. See, because each lab will have their senior embryologist, and they put on a SOP. The SOP is a nice book or a few pages for each step that you're doing.
So from your experience, have you come across anything like, clinical outcomes have improved post upgrading or replacing any specific equipment? Really curious to know.
Okay. What improved my success rates? See, the incubator, you concentrate on the incubator. That is the crux, because that is where the embryos live. So leave alone the patient. I'm taking the patient out of this equation. I'm taking out the gonadotrophins out of this equation, because that is also another. If you say gonadotrophins and culture media have equal importance in giving the quality of the gametes and the embryos. So I'm taking that the patient is a 28-year-old normal responder with having the best of gonadotrophins, best batch of gonadotrophins, I should mention, not just any gonadotrophin. Even the best of gonadotrophins can have batch variations, and one batch will be better than the other. So that best batch. And the best batch of culture media as well, that also there's got a variation. So in that case, incubator is the crux. If your incubators you maintain well, which means you have a daily QC of your incubator. You don't just look at the incubator and say, today it's showing 6% and 6% CO2 on 37 degrees, but you actually have a CO2 analyzer and a thermometer inside. You look at it and the CO2 analyzer, you check the gases regularly, and you keep variation, you keep every equipment will drift. You have to bring it back to the median. So if you keep doing that, that's what improves the results.
Thank you. So in that vein, like you were talking about gases and this thing. So many times while designing the lab itself, we need to make sure the gas room, the level of the gas room, and every day, upgrading the things. There were some points where, especially in COVID times, the trigas, all the supply was a big problem, and we had problems with, embryo development or excessive fragmentation and things like that. So how do we ensure from which vendor we get this, supply, whether they are, hospital grade cylinders? These are very, very difficult thing for us to
That's the
understand.
most difficult thing, because if you buy from the actual corporate thing, your per gas cylinder is so expensive, prohibitively expensive. So you tend to buy from the local available one, whichever is gives you the better one. So that is why we say, please keep an inline filter. For each of your gas, please keep an inline filter. Luckily, I have the incubator, my bench top. I have to give the nitrogen separately. It is not dry gas. And I adjust the amount of CO2 that I want, 6% or 5%, whichever I prefer. So luckily in that way, but here also the nitrogen has to be of good value. Otherwise, it doesn't work well. So during COVID, I found it difficult. So I made it into a CO2 incubator again. I switched off the oxygen O2 analyzer. I switched off the nitrogen, and that also became only my CO2 incubator when I didn't have any issues with the results. But then those are all the things that we don't anticipate, but it can happen.
So all of us, we don't know when an eventuality will happen, when an emergency situation, like for example, in Chennai, we are prone to tsunamis, or sometimes we really don't know. Sometimes any
Flooding.
calamity can strike us.
Flooding.
So, so should we have some sort of an emergency kit in the IVF lab, and what should it contain, if at all? And, like, I don't know. I mean, I'm just contemplating, because many times I've heard people abroad, especially, in California and other ways, they do prepare for emergencies. So should we have some kits where, there is some light source backup, some, some torchlight with long, keep charging it, or we have some manuals of those vendors whom we can, kind of keep it as a ready reckoner with us, because everybody will not know from whom to call for help and things like that. So I'm just thinking your
Yes. So I think the protocol, usually the SOP goes like this. Whenever you buy something, that vendor sticker is put on the machine and which year it was bought. And you also put right next to it who is the present service person along with it, and then their phone number. That is something which should be there on all the equipment, so that the moment there is a problem, you just look at the side and then say, this is the service person, this is the number, let's call them. A torch is a bare minimum in all the rooms that we have in the thing. Otherwise, you just go to the next room, which is the OT. There at least 2 torches are always there, and then you pick them up. In terms of emergencies, let's say in 2015 flooding, that was probably the worst emergency we've had in the recent times in Chennai. What happened was the entire city was cut off from the rest of the part of the country, and full of water. And there was, after 4 days, we didn't have any diesel or anything to run the generator also. So there was no power backup. So what exactly we did was, after that only I put up the SOP for that also. So whenever we foresee a condition like that, that's when the next year we had similar condition in Kerala. So they called all of us from Chennai. They called me. So many people called me to ask, what do you do? How do I go about this? The first thing is, never have your IVF lab in the ground floor or the basement. I would at least in the first floor. When you have it, always have enough liquid nitrogen to fill your tanks and close it. The moment you close the liquid nitrogen tank along with the thing and you don't open it, the evaporation is extremely minimal. Whenever you see the liquid nitrogen tank, it will be written, let's say 2020. What it means is it can hold 20 liters of liquid nitrogen and hold for 20 days. If you don't open it, if you fill it and close it and you don't open it, it can hold for 20 days. So when you don't open it, it remains like that. So what we all did was we froze everything we had, which means you must have the freezing kit always available with you. So that's how we prepare for rainy days in Chennai every time now. So we have an extra vitrification kit. So just in case we need to vitrify everything, everything happens. So you vitrify whichever stage the embryo is in, oocyte or zygote or 2-cell or 3-cell or 4-cell, or on day 2 or day 3 or day 4 or day 5, freeze it and put it in the liquid nitrogen tank, fill the liquid nitrogen, lock it and just keep it in a second floor or third floor and then go off. That's what you can do. That's the best thing you can do to your embryos when you are flooded or anything. Suppose you have an event of fire. The liquid nitrogen tank can hold it for some time, but it is best to move the liquid nitrogen tanks away from it. And that is why if there is a problem like that, then it becomes that you have to take the embryos and oocytes also out of it, freeze it and take it off. You may not have the time. So whatever you can save, you might have to save. But fire being less, let's say we haven't seen it much, but then flooding is something we see every year in Chennai at least.
I saw one very interesting thing which they have done in one of the labs. Is like, in the cryo rooms, the liquid nitrogen tanks are actually anchored to the wall. There is a stand in which they place the liquid nitrogen, and that stand is anchored to the wall, so that during earthquakes,
Okay.
So
fortunately, that's something we don't have, but flooding is something we anticipate every year. But
so that is one of the interesting thing I noticed.
true. I think it all depends on what are the problems that you see in your local area. That is in your geology, what is there, you'll have to work around that.
See, there's one question: when doing batch IVF, can you give some tips regarding lab maintenance and checks before starting the batch?
Okay. That's a good question because that's something which keeps, even though we keep talking about it, there's always doubt about it. See, as an embryologist who's going to go for batch IVF, you start your work at least 10 days before. You put a SOP and ensure that all the equipments there are calibrated by the service person at least 10 days before the start of the batch. From then on, it has to be QC'd on a daily basis until the batch starts. So we cannot go 2 days before and do it. It has to be done at least 10 days in advance. And no need to stop your incubator between 1 month and another month batches, which means you have to recalibrate, which takes at least 3-4 days to be done. So you just it just have to be there. Nothing harm happens. Just leave it there and come. The incubator does not take much of electricity or gas, so you can forget about it.
So if we were talking about AHU, which is not mandatory, if you run with a Coda filter, it's fine. So do you feel that, 24/7, 365 days, either the filter or the AHU should be on? After all, they have machines, they can also conk off, or we can give a 2-hour switch off period every day and switch it on?
The problem with the AHU when you switch it off, yes, you can switch it off sometime and take it. But then when you're working, at least it should be there. It is ideally to run it 24/7.
And also in the cryo room, many times, in Chennai, it is quite hot, right? Is it mandatory to have, obviously a ventilated room is definitely good, but then an air condition with a proper set temperature, is it good to maintain?
I think AC is a must for our condition for cryocans. Otherwise, you'll have to refill every day. Otherwise, the evaporation is so much, you'll have to refill every day. It's best to keep them in a air-conditioned room.
Sir has given one very important tip. The unpredictability of death and failures in IVF lab process is a reality we must face. but our focus remains on
Yes.
the checklist system. This is mandatory. I think whether we are doing batch or daily, the checklist check it every day.
Every day, the one of us come 1 hour before and do the checklist. Every day, from dustbins to the gases to the temperature, CO2, O2, everything is checked. The gas levels, everything has to be checked. And at the end of the day, you switch off whatever needs to be switched off, and you check what is the remaining media you have. Take out the dustbins. Everything needs to be done as per your SO. And that is why to have checklist is very important in not only in the theaters, but in IVF lab as well.
So it's ideal to, have a storeroom as well to store all your, consumables and other things, because, again, it's going to increase your VOC in the lab and keep minimum clutter in the IVF lab, right? So
Absolutely. You IVF is not the storeroom. Your storeroom is separate. There, the dishes and the cover and everything is aired for, like, it remains there. You have in your lab only the bare minimum that you would need for the, like, the next few days or something like that. And you have to restock from the storeroom. And this is also not the place to have your paper storage also. That also has to be done outside only.
what about the lighting in the IVF lab?
I'm not sure. There are some papers which say that too much lighting is bad because the fallopian does not have too much amount of lighting. Per se, I'm also the kind, maybe because it was grilled into me and ingrained into me when I was studying, that I don't use much of light. Like, there is light, but it's not like bright like the OTs. It's like your laparoscopic theaters. Dim, but some light is there. And another thing that I would always recommend or suggest to all the embryologists, do not get panicked and run around in the IVF lab. The more the movement, the more panicky the movement, more the number of people in the IVF lab, the higher is the VOCs. So everything in IVF there are no emergencies there if you do it well. You just have to plan it and do it well. No running around with the dishes. Walk slowly, steady, but at the same time brisk, because you can't take 5 minutes to reach from the laminar airflow to the incubator. Everything has to be set within the radius of 3 meters. That's also is important.
With so much of technological advancements in the field of, equipments or IVF lab arena, do you think at least, a bare minimum of an alarm system only for the cryo alone
It's
could,
good to have. It's good
it's
to have.
it's good to have, right? Because the other alarm systems, they're all quite expensive add-ons as far as, our
Yes.
setting is concerned. But cryo alarms probably, do you think that,
It is good. It is good, or else you have somebody to check it every day.
so what about, lot of things about AI, integrated equipments, and a lot of other things. Since it's a master class, I just wanted you to, little bit,
AI is something we wish it comes around. Like anything that can help us grade embryos better or select embryo better to give a better implantation rates, we will grab it with both our hands. If not, I will hire a few more hands and grab it also. There is nothing like, but as of now, we will have to wait for the better versions of it to give it to us. But we would be very happy with that.
you were talking about the equipments in the donor bank, right? So donor bank is also, can handle semen samples, right? So it doesn't require a cryo tank as a mandate.
It is not mandated, but that's how they are supposed to do. Um, can you give me 1 second, please?
Yeah,
I'll
yeah,
have to
sure.
take a very important call. Just sorry, 1 second, please.
Sure, sure.
Sorry, tell me.
No, I also got cut off actually. That's fine. I think we were discussing about
The AI, and yeah, we are yet to catch up with that. Like, it is yet to catch up with us. Just a second, please. Sorry. Sorry, some phone from my son's school. That's why I get flustered whenever there is a phone from the school.
No. It's very important to take. So, in a nutshell, no, we were discussing about the donor bank having the cryo tanks.
Yeah, they are supposed to, but it's not mandatorily said. I'm surprised at that as well.
So, I think we have answered a couple of questions which was already there in the chat, and I would like to, if there are more questions, I will share it across with you. You could please
Absolutely. Anytime.
And I thank all of you who have, wholeheartedly been a part of this masterclass series. And I'm extremely privileged and honored to have Dr. Ramaraju sir here for
I know.
during this session and, give us his valuable inputs and remarks. Thank you, Dr. Priya, for taking out, your precious 1 hour plus of time.
No. It's entirely my honor and my privilege to have been able to give this talk here. Thank you so much for the invite.
Can you just share the next masterclass, please? So our next masterclass will be on 18th of September by Dr. Naina Patel, madam. She'll be talking about advances in ART on a topic which is very close to her heart. I think she's going to talk about stem cells and PRP and other things in regenerative medicine in ART. So we will see you again on 18th of September. Thank you so much, Dr. Priya, entire team, Aishwarya, Sindhuja, everyone who have, been part of our masterclass series. We welcome you all. Thank you.
Thank you so much.
Thank you.